Okay, my friend, you are a little different case, so
Okay.
we have to discuss, tell your situation
Yes.
to everyone,
Yes.
because you have MicroTESE plus varicocelectomy.
Sure.
So now it's fourth day after the procedure,
Yes.
and I am looking always after the varicocele operations if there is good blood flow, but now I am also looking, is there any damage
Right.
after the MicroTESE, because we open your testicle like opening like into two half,
Sure.
and we look for the good tubes.
Yes.
Fortunately, thanks to Allah, we find good sperms,
Yes.
good quality sperms. We find good tubes,
Mhm.
and they did the MicroTESE plus XC.
Yes.
Now, when I look to these tests, is there any changes because of MicroTESE? Yes, of course. Look at this. Look, some small parts are
Right.
affected. They will heal. They will heal, but the rest is very nice. There are some small parts that we took the samples,
Sure.
but the testis is looking nice. When I look to blood flow, you see blood is coming into the testis nicely.
Mm.
Actually, it is more than normal varicocele operation. Maybe there is tissue healing. That's why blood is flushing, rushing into this testicle, trying to heal the tissues.
Fantastic.
So we find sperm, we did MicroTESE. People ask me, they say, I have Azoospermia plus I have varicocele. Which one I should go first? So if you have time, if your age is enough, maybe the best is do the varicocele surgery first, then go for, maybe you will give normal sperms, maybe if you need MicroTESE, it will be more successful. But if you don't have time, you are coming from another country,
Sure.
so you come with your wife.
Yes.
Our gynecology doctors, IVF doctors get ready her.
Mm.
They prepared her. Then we did the MicroTESE plus we did the varicocele.
Yeah.
Fortunately, the sperms are very nice. They find good sperms.
Yeah.
What's the number of sperms they find?
5,000,
5,000.
which
yeah.
is good quality. Yeah.
Very good quality, 5,000 sperm, which is very nice.
Yeah.
And they did the transfer to
Absolutely.
How many?
They transferred two embryos,
two embryos.
and
Nice.
3 have been frozen.
Yeah. So this is nice. MicroTESE has 50% chance. In 50% of the patients, unfortunately, we are not finding sperm.
Mm.
But in your testicle, when I look with ultrasound, I said, hey, this is a good testis. I hope there will be sperm in it.
Okay.
And yeah, it was like this. Now I'm looking to your spermatic cord.
Right.
Remember, before the operation, there were too much veins. Now they are gone.
Okay.
I take them out.
Okay.
This is only artery here.
Right.
It looks nice. I close the colors to increase the resolution.
Okay.
I move to this white tissues are edema.
Okay.
They will disappear, and I come here to testicle.
Right.
Okay, all the big vessels have gone.
Okay.
Varicocele is over. We find the sperm in MicroTESE. This is what I recommend.
Yeah.
If you have MicroTESE and have varicocele, do it together. Why not?
Sure.
So, how was the healing? Is it difficult? How
No,
was
no, no. It was very easy. I mean, I feel very good. Initially, there was a lot of swelling, but after the 2-3 days, the swelling went down.
Yeah.
And yeah, I feel
And
good.
could you walk and
Yes.
normal
Yes,
activities?
I've been walking, going to the shops, shopping.
Yeah. So you, of course, compared to a varicocele case, it is a little more difficult, more tricky, and
Sure.
but you will spend more time in Turkey because
Yeah.
you will wait for the results. Now
Yeah.
they transferred, and 15 days later they will
Yeah.
say you if it is continuing or they
Yeah.
lose the embryo. So you have more time, and we will do more controls. But now it's very nice. Yeah, let me show the operative photos one more time. Okay, my friend, now in the operation, of course, we first did MicroTESE. This is the most important part. Then we go with, and let me show in MicroTESE what we find.
Okay.
Yeah, I think this one, no, this one. Maybe.
Yes, that one.
Yeah, that one is the best one. So look at this.
Running.
Yeah, it's trying to escape. We catch it. So yeah, it's they find really good sperms. Unfortunately, it is only happening in half of the patients, in azoospermia patients.
Okay.
Yeah, I want everyone to be like this. We are working on this, but unfortunately, only in half of the men. Where is it? It was really trying to escape.
Yes.
Yeah. And the best thing, this hospital, you know, they are very experienced on this.
Yes.
Easily can. For example, first they show me.
Yeah.
Let me show you. They show me this one.
Yeah.
I couldn't see it at first.
Yeah.
Or show me that one. They said, "Oh, we use it." Yeah, it's
In the
something
top,
moving here.
Moving there, yeah.
But they also see other sperms too here.
Yeah.
It's difficult. They get used to. Here they also see some sperms I couldn't see.
No.
Here they said one,
Yeah.
and here they said one.
Yeah.
Now my eyes also get used to seeing that. Okay, it's now focused. Be better.
But 5,000 is a lot,
Yeah.
isn't it?
Yeah, very good.
That's
Because
small
immediately when I opened the testicle, I saw the good tubes. Give some samples, they find it immediately. So we didn't do too much dissection in the testicle, too much tissue resection.
Yeah.
So, and after that, this is the varicocele. So, you know, my technique is to remove these veins. I don't want to leave them here.
Absolutely.
So, we removed it.
Okay.
And
It's very big.
yeah, it's really big, maybe 25-30 centimeters.
Yeah.
And we remove the inner part, outer parts, and then we take out a lot of vessels.
Yeah.
And we can write your initials.
Absolutely.
So, yeah, that was a good operation. We are very satisfied. And you said the healing was not problematic?
No, it was not a problem at all. Although I was worried because, you know, like 27 years ago, I had the right testicle removed. And
Yes.
after that, I had hematoma and I had to go back and drain and, you know,
Yeah.
But, so with that bad memory.
Yes, you warned me. You said, be careful.
Yeah.
But I was careful, but
Yeah.
you know, I am always doing this operation.
Yeah, yeah.
So
sure.
experience is
Yes.
different, something
Yes.
different. It helps, it really helps.
Yeah.
Healing is, but still I have some patients who have bleeding and
Yeah.
they have big hematoma in the
Exactly.
scrotum. We know how to manage it, how to deal with it.
Yeah.
Usually, or maybe nearly never we need another operation. We know how to do if something happens like that.
Yeah.
So, do you know Mandek?
Come on.
Yeah.
Yeah.
Mandek.
Monday. In Somali.
Yes.
Yes, Monday, yes.
Yeah, I am a Somalia fan.
Yeah. Yeah.
It's
No,
my mom.
with that bad memory, you know, I was worried, but this time the healing was very, 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 very easy for me. And you know, I did not feel any problem. I was checking always, and I saw the swelling is going down.
Yeah.
In the second day, I used ice pack. When I
Yes.
called you, I said,
This
can I
is-
use
yeah.
ice pack? I just used ice pack for 1 day.
Wow.
That's all. Only the second day. I didn't
Yeah.
use again.
The swelling is very common.
Yeah.
It's not like if we hit your face, there will be
Sure.
swelling.
Yeah.
So here the swelling happens. Everybody has concern,
Yeah.
but I say let's relax and use it, and it's really affecting nicely. Thank you for coming. Inshallah, everything will be very successful. We are
Inshallah.
now waiting for the results of the IVF.
Yeah.
In 15 days they will come out.
Yes.
But I hope maybe next year you
Yeah.
may even ejaculate normal sperm, because
This is
everything
my dream.
seems normal.
Yeah.
Unfortunately, not everyone is that successful.
Yeah.
In half of the azoospermia patients, we cannot find sperm inside the testis,
Yeah.
but we have to do what have to be done. I recommend everyone, if they have azoospermia plus varicocele,
Yeah.
if they have enough time,
Yeah.
if they are patient enough, they
Yeah.
can do the varicocele first,
Yeah.
then wait for the result
Yeah.
and do the IVF 1 year later.
Okay.
But if, as your case, they
Yeah.
want to do it as quick as possible, so during MicroTESE, it's
Mhm.
possible to correct the varicocele.
Right.
They can be done together, like your case,
Yeah.
and I recommend it to be done in this way.
Absolutely.
Thank you very much for coming, for choosing
Thank
us.
you, Doctor.
Thank you very much.
Thank you so much, Doctor.